In 2009, in May, I was playing horseshoes. I was healthy. I was doing security at Camelback Mountain, so we were having a barbecue. And during the horseshoe game, I couldn't even reach halfway to the pin. I lost all strength and coordination in my body. So when I would try to throw straight, I'd throw to the left, or I wasn't able to throw at all. I went to the doctor, who sent me to a neurologist, who noticed that my right side was very, very weak, and this is really out of nowhere, in the blink of an eye. So after that, I went and I had an MRI, and 2 days later they called me here at the college and they told me that I had a very large brain tumor, what you saw up there on the screen. And me knowing nothing about brain tumors, I figured I'm dead. And so I had to go home, tell my wife and my kids that I had a brain tumor, and I went to the neurosurgeon and they told me that I would have been dead in 2.5 weeks. They never saw a brain tumor that big. It's a meningioma, and that's one that grows on the outside of the brain and the meninges. They call it a benign tumor, but that's just a misnomer. That's almost a joke. Benign just kind of says that it's non-cancerous. So it was a non-malignant type tumor. But benign, it was not. Because, as you saw, it crushed my brain down as far as it would go. It hit critical mass at the barbecue, pushed my skull up 4.5 centimeters, okay? So by the time I finished work to go into surgery, I had no coordination and strength to even write my name, drive, or anything else. I went through surgery, okay, and they said that I was lucky I made it to surgery because they said that within 2 weeks I would either, if I didn't get it discovered, I would either had a grand mal seizure or slipped into a coma that I never would have came out of. So when Dr. Michaela said I should be dead, I should be dead, and that's fact. I did surgery. It was 10.5 hours of surgery. They embolized me the day before, excuse me, where they cut off the blood supply. See, tumors need blood to grow, and mine was growing for over a decade. So as huge as my tumor was, I had 6 major blood vessels that were feeding this beast. They were able to cut 5 of them off during an awake surgery procedure that I had called an embolization. What an embolization does is they keep you very, very still. They inject you through your groin with what can be described only as little balls of glue, okay, to cut off the blood flow to the tumor. They were able to get 5 out of the 6. The 6th one was wrapped around my left eye so big that they had to get it during surgery or else I'd be blind in my left eye. I was awake for this, like I said. I had to feel everything, and it was the worst pain I ever felt in my life because you couldn't move, and every time that it cut one of them off, it was like somebody's putting a fireplace poker into your head. So that was pretty unpleasant. And I had a very, very good chance if I didn't have this done, I would have actually bled out on the table and I would have died because no amount of blood transfusions would have saved me. So I had to have that done, and I had to have it done the day before surgery because blood vessels have a way of actually making new connections really quick. So they had to do it so that there was no chance that new connections could be formed to actually hook back up so that the tumor would keep growing. So after 10.5 hours of surgery, obviously I lived, okay, but they couldn't save my skull, so it was compromised. So 1/3 of it is titanium. And to look at me, you'd never know, but it's all metal. When I went to the U.S. Capitol, I set off all kinds of metal detectors. So I got the attention of 6 very heavily armed men, which was good because at least we know the equipment works. But and they put me back together. It was pretty amazing when they did the craniotomy. What they do is they strap your head into like a halo and they put screws on. I still have holes right here, indents where the screws were in my head, and they keep you so stark still. And then they went and they peeled back my scalp, and usually they'll put, for the size of the tumor, 3-4 bore holes into your head. Mine was so huge they had to put 12 holes into my head, and then they started to saw my skull off. Okay, pretty horrifying. And they could feel the pressure. The surgeon said they could feel the pressure before they were even halfway done sawing of my skull pushing up because of the tumor. So actually, when they put it back, and the bone was compromised, so they couldn't put it back on. Usually they will put the bone back on after surgery. So they actually put titanium mesh, then they put bone plaster, almost like they were a contractor, right? Then they screwed it in, and then they put my scalp back over it. And the only time I really know that it's there is when like a low pressure system moves in, and I can feel it pressing up against the pressure inside of my head pressing up against the plate. But also another thing that happened is I kept my cognitive abilities pretty well. I was able to recognize people right after surgery, but the motor skills were damaged to the point where I was paralyzed from the waist down, and they did not know if I'd ever walk again. So I spent a week in the hospital, then I went to Good Shepherd Rehab over here at Pocono. They made special accommodations so I could be near my home and my family, and here at ESU, I was 200 yards away from my office and my store. So it was, you know, it was more comforting to know that I was that close. And they worked very, very hard to make me walk again as new connections were made from my brain through my spine and down to my lower extremities. But it took me months of inpatient and outpatient therapy to walk again, and I'm very fortunate and blessed and humbled to be able to walk, work, talk, you know, and you know, just basically live and be the father and husband that I was before. So that's my story in a nutshell. I'm really going to just take all your questions, just so long as you know there's nothing off limits. You can ask me anything.